Hi, this is Dr. Gitika from Origyn IVF Center. I'm one of the IVF consultants in this center. Origyn IVF Center is one of the leading IVF centers in North India, and it has been awarded as the best IVF center in North India by Economic Times in 2019. We do have four centers in Delhi. The main center is in PURA, and we have other centers in Dwarka, South Hacks, and in Vikaspuri. So today in our session, we will know what fibroids are and how do they affect our fertility, and what treatment options do we have with these fibroids if you're not able to get pregnant. Fibroids, they are fairly a common innocent growths from the muscle layer of our womb, and almost every third female between the age of 30 to 50 is found to have fibroids. Fibroids can cause many symptoms. The main symptoms which the fibroid cause is excessive bleeding during our periods. But yes, fibroids can be one of the reasons for infertility as well. This depends upon many factors. Firstly, where the fibroid is located. What is the size of fibroid? And how many fibroids do we have? Fibroids are mainly classified into three types depending upon their location with respect to the womb. If they are towards the inner layer of the womb and they are popping into the cavity, these are known as submucosal fibroid, and these are the kind of fibroids which are mainly responsible for the infertility and miscarriages, and definitely they need to be dealt with. Second variety of fibroids are the intramural fibroids, which are present in the muscle layer of the womb. Whether to remove these fibroids or not, the studies are conflicting, with some studies suggesting that these fibroids should be removed if they are more than 4 to 5 centimeters in size, or if they are located in an area where the fallopian tube opens into the womb and they are blocking that area. Third kind of fibroids are the subserosal fibroids, which are present towards the outer layer of the womb. These fibroids are not known to cause much of any symptoms, and they can be left as such. How do fibroids cause our fertility? Fibroids can affect our fertility in many ways. They can raise the inflammatory markers in our body. They can affect the transportation of the egg and the sperm. They can distort the cavity and prevent the fertilized egg from implantation, or if implantation occurs, there can be a deficiency in the blood supply to the growing fetus, and there can be miscarriages. Fibroids, as already told, can block the opening of the tube into the womb. So almost 5 to 10% of the females with infertility, they are found to have fibroid. But that doesn't necessarily mean that fibroid is the sole culprit, or the fibroid is the culprit of your infertility. For a pregnancy to occur, we require healthy eggs, healthy sperms, and an open tube. So this has to be evaluated if that particular fibroid which you are having, that is the culprit of your infertility or not. Study suggests that fibroid is a reason of infertility in 1 out of 100 females. That is 1 out of 100 females who are not able to conceive. How to deal with this fibroid? Though recently we do have some medications for this fibroid by the name ulipristal acetate and GnRH analogs, but when it comes to planning a pregnancy, then definitely surgery is the mode of treatment. As already told, submucosal fibroids have to be removed, and this can be done through hysteroscopy. Hysteroscopy is a day case procedure, and it doesn't involve giving any cut on your tummy. Here a thin telescope is introduced with a camera is introduced through the vagina into your womb, and the fibroid is taken out. So it involves no cut on your tummy, and just 1 day admission is required. Pregnancy rates and live birth rates, definitely they increase after removing them. If we talk about intramural fibroids, if they are too large or if they are popping into the cavity, they are so big that they are distorting the cavity, or if they are blocking the tubes, then definitely these also should be removed. And to remove them, we have to go for an abdominal surgery. This surgery can be a keyhole surgery, which can be done through a laparoscopy, or it can be an open surgery, which involves giving a transverse cut on your tummy, taking the fibroid out, and then reconstructing your womb. You can plan for a pregnancy or your fertility for about 3 to 4 months after you have this procedure. So this was in brief about fibroids, what they are, how they affect our fertility, and how can we treat them. If you are having fibroids, then please don't worry. You can contact us. You can contact us at the number which is being displayed, and you can email us and for your further queries. We are always there to help you. Thank you so much.